Welcome to the Commissioner's Report. I'm Steve Barnes, and with me today in the studio we have Commissioner of District Number 5, Neil Combee. Thank you, Neil, for joining us today. And his special guest, Ann Clausen from Central Florida Healthcare. Ann, thanks for coming on today.
Thank you for having me.
Now, the reason we have Ann here is we want to kind of talk a little bit about community health. Polk County has a long history in community health and taking care of the residents of Polk County. Can you just kind of tell us a little bit about some of the background of Polk County's community health systems?
Yeah, it goes back a lot further than I go back. I think in the 1920s, Polk County, the taxpayers and the Board of County Commissioners built the Polk General Hospital, which was a charity hospital. It was, to make sure that folks, regardless of their means, had a place where they could get medical care in the county. One of the few in the state. I happened to be on the board in the early 90s when there were the folks that were coming there. The numbers were continuing to drop off. It was an aging facility, needed a lot of work. At that point, was 70 years old, I suppose, and I'm sure it had been pretty well maintained, but it was hard to compete with some of the area hospitals, right. And we certainly couldn't compete. We figured out after a bit of study that we would never be able to compete for private pay patients. Mm-hmm. So we made a decision, instead of having a lower level, that lower tier of health care for folks who did not have money, we would close the hospital, take some or all of that money, and give it to other healthcare providers and let them take up where we left off, and let the hospitals do the hospital work, and also we give money to them as well. And the taxpayers have always been supportive in this county of charity care, of indigent health care, through sales tax, additional sales tax that are it's been voter approved, and
not once but twice.
Yeah, the most recent. Well, even I think maybe even before that. When it may be that we took money that we were, and I don't recall specifically, right, that we were using at Polk General and kept that over and give that to folks like Central Florida Healthcare and mm-hmm. other providers in the county.
Right.
But always been supportive of it, and have reauthorized it, I think, up to 2044.
Yeah, it's quite
so you're
a ways
looking back
out.
Almost 100 years ago when Polk General started. Do it a little different these days, but still, have a great safety net, I think, that works well, and because of Ann and the folks that are in the business.
Yeah, I think that's one of the things that makes Polk County's system unique, is that we're not relying on one hospital to take care of it, but we rely on multiple organizations to take care of community health, and each organization, it seems like, kind of specializes in different things. So, Ann, if you could just tell us, Central Florida Healthcare has been around for a long time. Kind of give us a little history, and what kind of things do you take care of in the community?
Sure. So Central Florida Healthcare just celebrated our 50th anniversary, July of this year, and we have 13 community health centers located in Polk County, and we provide medical and dental care for adults and children. We have behavioral health services, OB/GYN, and we also have full lab services, lab and x-ray, and offer full pharmacies in most of our community health centers.
One of the things that I thought was interesting was that you've also been involved with helping folks navigate the insurance system, which can be really difficult at times.
Yes, we have at each one of our community health centers, we have certified navigators that work with the public, the patient population, and helping them on various services, if they're eligible for Medicaid, if they're eligible for any other services that they would need, whether it's related to food, transportation, housing, but they are all certified and trained to work with our patient population and with the community on those various needs that they may have.
Now, in recent years, we've had the American Recovery Plan that has been put into place. A lot of federal dollars have been distributed throughout the country to local governments to put the money where they see fit the most, kind of taking it out of this big giant government thing and bringing it down to the local level. You guys have been the recipient of some of those recent funds. Just kind of tell us how you've been able to utilize those funds to provide more and better service for residents in Polk County?
Sure. So we found out about the funding through the United Way. I sit on the United Way Board of Directors and found out about this funding opportunity. And so Central Florida Healthcare actually applied to receive $1 million, and then our responsibility was to have a lot of our navigators, and we hired some staff to work with the local residents of Polk County, those that had, due to COVID, had lost their jobs, were unable to pay for rent, unable to buy food, to pay electric bills. And so we worked with all these individuals and were able to disperse $1 million out to the community to help those that were affected by COVID.
And that's incredible, because I think a lot of times when you look at, in business now, $1 million isn't that much, right? But when it's $1 million applied to services that you're directly distributing to people, that's a lot of funding that gets right into the pockets of the residents of Polk County.
Yeah, so very proud of what we were able to do.
Yeah. Now, that was the first round of ARP funding. After seeing how efficient you were with the distribution of those funds, Polk County looked to you guys to, Commissioner Combee, you recognized what they were doing with the funds. Just talk about the decision to continue funding Central Florida Healthcare.
Well, I don't know that I really wanted to do it the way we did it. I happened to bring it up and point out to the other board members that in Brevard County, the commissioners there were taking their whole pile of money and they were dividing it 5 ways, and each commissioner would go out and decide how they wanted to spend their money, because there's
different needs in different districts.
Solicit proposals from people and see what comes in, and then pick off that list. It worked out fine. I took all my effort and put it into healthcare and behavioral health, which I thought was a tremendous need, the behavioral health especially. So between Central Florida Healthcare and the Haley Center and Tri-County, pretty much consumed my portion. But I was happy to do it because I knew that they have a track record. Some of the folks that were asking for money didn't have much of a record, and I thought I would play it safe and go with those that we know are capable of getting it done.
Now, Ann, your organization has been allotted an additional almost $800,000, $799,000. What are the plans? How do you plan to utilize those funds?
So having community health centers, we're always looking at that opportunity where we might need to grow and expand services. Lakeland being one of those. We purchased a building many years ago. It was part of a school church, and it seems like the minute we moved in, we had outgrown it. And so that location serves about 150 patients a day. And so we've been looking at the opportunity to tear that down and build a new community health center. And so we'll be using those funds to do that in the very near future. In the current Lakeland location, we provide medical and dental services for adults. Our pediatric clinic for medical and dental is down on South Florida. So this will give us the opportunity to bring that location for children to our adult location, and so we can expand services. As a patient-centered medical home, it's important that we can treat the entire family. So being able to pull the pediatric services down, and we also have a location on Lakeland Hills that provides adult dental. And so being able to use these funds and build a new health center can bring all of those services for the entire family to one location. And it will also allow us to do more for diabetes. We're going to add a diabetes center of excellence at that location.
Oh, that's great.
And also be able to do more for behavioral health services.
That is terrific. Yeah, such needed services in the community, and I love the idea about taking them from all these different places and consolidating it, because let's be honest, gas is expensive. You've got to run back and forth. One kid needs an appointment here, another kid needs an appointment there. It really makes sense to try and consolidate and put it all in one location for the families. That's great. Well, guys, we're just about out of time. Mr. Combee, if you could just give us a final kind of thought about why it's important to continue supporting organizations like Central Florida Healthcare and some of these other community organizations.
Well, obviously, there's an awful lot of people, whether you're rich or poor, you have medical issues and you need health care. Rich folks don't have too much of a problem, or those with good insurance, but there's a lot of people in the county, and a lot of them, friends, family. I know a lot of people that do not have insurance.
Or underinsured.
And for a variety of reasons. And I think having somebody like Central Florida Healthcare around, it kind of gives all of us peace of mind knowing there's some place people can turn.
Excellent. Well, thank you guys so much for coming in today. I really appreciate your time.
Thank you.
And thank you for joining us for this episode of the Commissioner's Report. We'll see you again next time.
Thank you for watching. For more information, go to polk-county.net.